Patient, 41 years old, no previous medical issues, unhealthy diet, heavy alcohol consumption, family history, alcoholism, father's side.
Oh, I'm late for work. Oh.
So what's been going on in your life? I've noticed you've been drinking a lot.
Oh no, I've been drinking for years, but like lately my stomach's been hurting and stuff, and I've been really nauseous.
Well, I think you should take the drinking down a notch, and I think you should go see a doctor also.
Alright, I'll go in tomorrow actually.
Okay.
Hello,
Hi, how can I help you?
I have an appointment today.
Okay, can I have a name and birth date?
It's Jacob Dubiak, and then May 5th, 1977.
Okay, you're all checked in. You can just have a seat in the waiting room.
Okay, thank you.
Hi there, I'm just going to need you to fill out a patient intake form.
Okay, thank you. We'll have my forms filled out.
Okay, thank you. It'll just be a few more minutes if you want to go take a seat again.
Okay, thank you.
I can take you to a room now.
Okay.
You can have a seat right here.
Thank you.
Hi, I'm
Hello.
Dr. Garrick. How are you today?
I'm good, how about you?
Okay, so what seems to be the problem today?
I've been experiencing like belly pain and like been really exhausted lately.
Okay, so it looks like here that you drink, about how many times a week would you say?
About 5, 6
Okay,
days a week. Yeah.
okay, and then how many cups of alcohol a day would you think you have?
Probably like a pint or more per day.
And then any other symptoms?
Well, I've noticed my palms have been really red, and my blood vessels have been really like prominent lately.
Okay, all right. So I think the first step, we should just take a quick blood test, see what we can find.
Okay, sounds good.
Hi, this is Nurse Maddie. She'll be taking your blood sample for you today.
Okay.
Hi, how are you?
Good. How about you?
Good. All right, I'm just gonna, if you wanna lift your sleeve up, I'm just gonna tie this around your arm. Just gonna wipe the area down. All right, 1, 2, 3. All right, you're all done.
Thank you. So when will I get my test results back?
It should take about 3 to 5 days.
Okay, thank you.
Hello?
Hi, this is Dr. Carrick from Ringer Memorial Hospital. Is this Jacob?
Yes.
Hi, I'm just calling because I got your blood work back and we did notice some elevated levels of your liver enzymes and your leukocytes. We want to schedule you to come back in about 3 to 4 weeks to see if we can get those levels down. So what I want you to do, reduce your alcohol consumption, see if we can get those levels to go down by themselves, and when you come back, we'll do another test and see where we're at.
Okay, sounds good.
All right, we'll see you then.
Thank you. Bye.
Bye.
Hey Jacob, how are you feeling this week?
I'm feeling alright. Pretty much the same as last time I came in.
Okay. So you're still feeling a little nauseous. Any new symptoms that you've started to notice?
I noticed I've been like bruising really easily.
Okay.
Yeah.
All right. So the next step, we're just gonna take another blood sample. We're gonna continue your changes that we discussed on the phone, and we will check back in another month.
Okay, thank you.
No problem. Hi Jacob, how are you?
Good, how about you?
Good. Okay. So we got your blood results back. Unfortunately, we noticed some abnormalities with the liver enzyme levels. So I'm going to go ahead and do an ultrasound, see if we can see any structural abnormalities, and then we can go from there.
Okay.
Okay, so we got your ultrasound back. Here is a picture of what your ultrasound looked like. Unfortunately, we are starting to see some of these fat deposits starting to form. So I'm afraid that you might have a form of alcoholic liver disease. The liver's main role is to break down toxins and remove them from the body. And alcohol is one of these toxins that when you drink excessively, your liver has to work extra hard to process it. Unfortunately, since you have been drinking for an extended period of time, your liver has been working really hard and it can be damaged, causing these fat liver deposits.
So how damaged is my liver?
Well, at this point, we don't really know the extent that alcohol has caused your liver. So there are 3 stages of alcoholic liver disease. First, like this, we start to see the fat globules that accumulate in the cells of the liver. So this stage is usually harder to catch because there are no obvious symptoms. And fortunately, if the alcohol consumption does slow down, the liver is able to regenerate and gain that normal function again. The second stage is caused when you continue to drink alcohol in excessive amounts and the fat deposits are already present in the tissue, so the liver becomes even more damaged and starts to slow down and showing signs of necrosis. So this second stage is called alcoholic hepatitis, and if you continue to drink, again, there's a third stage, most serious. The death of the tissue can progress even more, and it's called alcoholic cirrhosis. So with cirrhosis, the scarring of the liver is extensive, covering a lot of the liver, and it completely affects the liver's ability to regenerate. Unfortunately, patients with this stage of alcoholic liver disease do have the possibility of needing a liver transplant.
Do I need to transplant myself?
At this point, we don't know if your liver is that damaged, so we're going to do some more tests. We're going to start with CT, see if we can see any signs of necrosis in your tissue.
Okay. Are there any other tests?
Yeah, we can actually do a biopsy of the liver tissue cells to see if any other signs of this necrosis.
Okay.
Right? Okay, so based on the results of your CT and the biopsy, we have determined that you have a form of alcoholic hepatitis. So we've seen significant inflammation and necrosis in your liver cells. The good news is that I believe we've caught it early enough so you won't need a transplant. The best way to treat this and prevent any worse symptoms is for you to stop drinking immediately. Improve your diet will also help. We can talk more about treatment methods if you have any more questions. So the most critical part, as I mentioned, is to stop drinking, but we can prescribe you with some medications to reduce any liver inflammation. I would also recommend putting you on a special diet to improve your nutritional intake. This would include reducing your sodium intake and increasing your consumption of vitamins and other nutrients. So here is just a picture of the CT. You can kind of see here that necrosis of the liver. And then I also have a picture of your biopsy. It shows, again, the necrosis of those cells. So we just need to start with those lifestyle changes, and we can go from there. If you have any troubles, we can recommend you with support groups to help you get through this.
Okay, perfect. Thank you.
Yep.
Hello.
Hi.
So I'm just going to talk with you about a couple options that your doctor has mentioned. So I know that you are diagnosed with alcoholic hepatitis. So with continued drinking, there is eventual development of cirrhosis in 20% of individuals. So you can be prescribed with corticosteroids that help reduce liver inflammation. These can improve survival with patients who have alcoholic hepatitis. As you do get older, your chances of survival will decrease if nothing continues to change. So there's been a new case study that explores increased hepatic venous pressure gradient, which is also known as HVPG modifications in patients with alcoholic hepatitis. It shows that patients that stopped drinking had fewer complications of alcoholic hepatitis and showed around 20% reduction in HVPG compared to people who continue to drink excessively. So I'm just gonna give you some brochures, and these have support groups that are also recommended to help you get through your hard time.
Hi, I'm Jacob.
Hi, Jacob.
I'm a recovering alcoholic. I was diagnosed with alcoholic hepatitis, and it's just been really a tough time, and I appreciate you guys being here. God grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference.